Hello, my name is Joe Herman. I am an associate professor in the Department of Radiation Oncology at Johns Hopkins. I'm also the co-director of the Multidisciplinary Pancreatic Clinic at Johns Hopkins. I'd like to talk to you a little bit about the role of radiation therapy in pancreatic cancer. Radiation therapy has come a long way in the last couple of years. In the old days, it actually used to cause a lot of toxicity, including skin redness and a lot of nausea and other symptoms. However, with improvements in technology, the symptoms have been drastically decreased from this treatment. In fact, radiation therapy is delivered so conformally and so focused now that patients have very little side effects from the treatment of the radiation. In addition, radiation is very much like an X-ray. You don't see it, you don't feel it, but the radiation over time has a cumulative effect of killing the cancer cells, but we're able to avoid normal tissues to decrease damage to those normal tissues. The role of radiation therapy has evolved very much in pancreatic cancer over the past couple of years. And in general, we are delivering radiation therapy in two different ways. One is called standard or conventional chemotherapy and radiation, or otherwise known as chemoradiation. This form of radiation is delivered over 5.5 weeks, Monday through Friday, and each day is about 15 minutes. This radiation has been very effective in terms of controlling pancreatic cancer and also helping shrink the tumor enough so that patients can potentially go to surgery. A newer form of radiation therapy called stereotactic body radiation therapy, or SBRT, has evolved in such a way that in only 5 days, patients can receive radiation, and early preliminary data is showing that only 5 days of radiation may be as effective, if not more effective, than the older way of delivering the radiation over 5.5 weeks. So therefore, there's a lot of exciting new ways to treat pancreatic cancer with radiation therapy. There are 3 different settings where radiation therapy can be utilized in your care. In the first setting, it's after the surgeon has removed the tumor, and then we're giving radiation to try to sterilize the margin where the tumor was and also try to decrease the chance for the cancer coming back. This is called adjuvant radiation therapy. In the second setting, radiation is utilized when the tumor is unresectable. This is also sometimes called locally advanced pancreatic cancer. And I think this is where we've made the most progress in terms of radiation therapy. We're now finding that in situations in the past, patients were not able to have surgery. By giving chemotherapy and radiation or SBRT, we can sometimes shrink the tumor enough so that patients can then go to surgery. In the third setting, we try to use radiation in what we call the neoadjuvant or the borderline setting. This is when the tumor is clearly resectable by the surgeon or where it might be touching a blood vessel, and therefore there's a chance that a little bit of cancer might be left behind. So we use radiation to try to sterilize that area, and then therefore at the time of surgery, it decreases the chance that there'll be any cells left behind. So therefore, there's a lot of exciting ways to integrate radiation therapy into the care of pancreatic cancer. As you can see, how exactly to integrate radiation therapy into your care can be overwhelming. Therefore, we highly recommend that you consider coming to the Pancreatic Multidisciplinary Clinic at Johns Hopkins, where medical oncologists, radiation oncologists, surgeons, and other healthcare providers come together in one room and discuss your case. This way, we together can come up with the best way to treat your cancer and also help you and your family make the final decision. We thank you for considering Johns Hopkins for your care, and we look forward to having an opportunity to take care of you. Thank you.